Good morning, everyone. Welcome to this session on the Always On Agenda, Creating Pandemic Resilient Health Systems. My name's Eloise Todd. I'm the Executive Director and one of the co-founders of the Pandemic Action Network, a group of civil society organisations seeking to prevent future pandemics. And it's a great honour for me to moderate this session here today at the Paris Peace Forum. The Always On Agenda is about creating resilient health systems. And in an era of a rising climate change threat, we're going to have more infectious disease outbreaks. So the question is, how do we create health systems that can both respond effectively to pandemic threats, but also have this always-on component so that they're always helping us, always being strengthening for our health systems, and can pivot quickly in a time of need. We're going to hear more about that during this session. Let me first introduce this fantastic panel that we have for you today. To my left, ambassadrice pour la santé mondiale pour la France, Anne-Claire Amprou. Vous êtes très bienvenue et merci. Priya Basu, Executive Head of the Secretariat of the Pandemic Fund, all the way from Washington. Dr. Magda Rabalo, former Minister of Health from Guinea-Bissau. And Dr. Ines Hassan, Director of the Global Health Security Consortium at the Tony Blair Institute for Global Change. So let me start by asking Dr. Hassan, Ines, to tell us a little bit about the main features of the Always On Agenda and how can it help to build pandemic resilient health systems?
Thank you, Eloise. And for those of you who are not familiar, I'm based at the Global Health Security Consortium, and this is a collaboration between the Tony Blair Institute, which is where I'm based, the Ellison Institute for Technology, and Oxford University. And we were formed during the pandemic. This is a non-sovereign group set up to support world leaders on the global health security agenda. And through TBI, where I'm based, we have the access to world leaders. So we work directly with the heads of states. And so this gives us a really good opportunity to keep global health kind of right at the top of the agenda, because as we know, it's not always at the top at the moment. So we're primarily focused on what Eloise called the Always-On Agenda, and that, as Eloise put very eloquently, this is essentially a health system which is primed to meet routine care needs, so the one that's in regular use. And it needs to be in regular use because we saw actually the delay in setting things up, the stop-start approach in the pandemic didn't really help us respond as quickly as we could. And so we need these systems to always be in demand. And so thinking about how then that system then can, if it is in use, then it can pivot very quickly in the instance of a global health emergency. So it's sufficiently resilient so that it has that kind of dual use aspect of it. And that's kind of the main focus of what we're trying to do. So one of the problems is that this, of course, requires political attention, requires funding, resourcing, and like I said, political appetite and attention for health system strengthening and pandemic preparedness, it's there, but it's not kind of where we need it to be. And this is worrying, of course, because the next pandemic is, as we know, round the corner. Affinity suggests a 27.5%, very specific chance of the next one occurring in the next 10 years. And so we need to think about how we can be better prepared. And so our goal is to convince world leaders and the private sector how to invest in their health systems now. That's kind of the real key. And so I'm just going to focus on a little bit on the political kind of argument here. So in order to kind of convince these leaders that they need to invest in specific parts of the health system, that we need them to be better prepared in the pandemic, but also serve that prevention agenda now, we need to make a case for immediate action. So why is this important now and not some distant future? We need to make that very clear. We need to show world leaders that this action can be politically popular and beneficial, and that it will yield a health and therefore an economic gain, which, if not immediate, will not seem impossibly distant. And the fourth is that we can create demand for use of these parts of the health system. So how do we do this? We're focusing on 7 principles when we're thinking about dual-use health systems. So one, putting prevention right at the very center of our healthcare systems, easing some of the burden from parts of the system. For example, I'm based in the UK, the NHS, which is overburdened, thinking about how we can serve patients focused on prevention, but outside perhaps of the overburdened space. Also thinking about detection, so identifying, monitoring early warning signs of the pandemic, and also using this to help with kind of routine care. Empowering community health centres, so primary healthcare, also ensuring equity through the new innovative solutions, making sure that data is accessible at all parts of the health system, coordinating manufacturing, and also building capacity in low and middle income countries. And basically, essentially what we're saying is if you boost these different parts of your health system, then you're going to be much better prepared when there is an instance of an emergency. So for example, we're focusing on 3 use cases. One is adult vaccination programs. We currently don't have adult vaccination programs. And so if we are able to create the infrastructure, the deployment and the use of this part of the health system to regularly create demand and use for adult vaccination programs, then we're serving, like I said before, the prevention agenda, so great, helping boost the health of our population, but also all of those parts of the health system, the digital registries, infrastructure that we had set up in the pandemic, a lot of that got dismantled. And so if we're using it regularly, again, we'd be better prepared in the instance of the pandemic. Same with setting up genomic surveillance capabilities and also building like clinical trial capacity. So we're focusing on thinking about how we can boost clinical trial capacity in low middle income countries where they don't have that capability at the moment, for example, across Africa. And so how do we increase demand there? And I'll stop for now.
Thank you so much, Ines, for that introduction to the Always On agenda. I'm going to move now to Priya Basu and ask about how investments in pandemic prevention, preparedness and response, particularly with the way you're thinking about it at the Pandemic Fund, how can they also benefit overall health system strengthening? How can we make sure those kinds of investment leave a legacy for health systems in LMICs?
Thank you very much, and great to be part of this all-women panel. Investments in pandemic prevention, preparedness, and response really are investments in strengthening aspects of the health system. Because when we talk about investments in PPR, we don't want to think about sort of pandemic prevention, preparedness, and response as some kind of a silo. What are we talking about? We're saying, stronger surveillance systems, ways to detect pathogens early, a workforce, a public health workforce that can, play a role effectively both in early detection and containment, but then also in treatment. So we're talking here of doctors, nurses, community workers, vets. We need capacity for treatment, so that's medical facilities. If you can't prevent an outbreak, then you've got to be able to contain it quickly, and that involves treatment. We need labs that can do diagnostics. We need strong public health institutions, and we need capacity to produce and deliver key medical countermeasures, vaccines, therapeutics, diagnostics. So these kinds of investments, these are the investments that we're making when we talk about investing in pandemic prevention, preparedness, and response. And all of this is, central to a stronger and more resilient health system that can then better cope with ongoing outbreaks and future pandemics. On the question of legacy, I think what's really important. What past pandemics have taught us is that there's a pandemic, there's panic, and then there's neglect. So this time round, having come out of COVID and with those memories still fresh, we really are determined to use the Pandemic Fund as a way to make those investments in peacetime, so to speak, so that the world is better prepared the next time a crisis hits. And as the WHO reminds us, it's not a question of if, it's a question of when the next pandemic will hit us. And those investments, in order to keep them going, these are not one-off investments in surveillance or detection or workforce. These are investments that have to be made continuously over time. Capacity needs to be sustained and maintained, so that requires both international support, but it also requires domestic commitment and domestic resources to be put in by countries themselves. So, I think this always on agenda, this problem really, this challenge really is a challenge that we've seen over the years. We've faced problems because we haven't been, committed to sustaining these investments and to keeping them going. And this time round, the Pandemic Fund, we see that as a new tool, a new kind of innovative addition to the international financing architecture, which helps us maintain the focus and continue to build those investments and keep them up and ensure that there's a legacy. So, thanks.
Thank you very much, Priya. Really well put. And it just strikes me, this is really about a win-win agenda, about how investing in pandemic prevention, preparedness and response can also serve current health system needs. So what's not to like for politicians? Je passe maintenant à l'ambassadrice Amprou pour demander comment pouvons-nous développer les stratégies locales,
How can we
régionales et
develop
mondiales
local,
pour faire
regional and
avancer
global
cet agenda
strategies in order to
always on?
advance the always-on agenda? Thank you very much. Good morning, everyone.
So I will speak in French, so make sure you have the device. Merci beaucoup pour
Thank you very much for this panel. It's lovely to see only women on stage. Now, this is a key issue, resilience of healthcare systems. So there are three levels of intervention and strategy at a local, national, and regional level. Let's be clear. This particular issue, health, or rather resilience of healthcare systems, is not specific to the least developed countries. No, this is an issue for everyone. It's everyone's concern. France included and other developed countries. So the terms are the same, the issues are the same, and this is why we need a dovetailing of local, national, and regional, as well as international strategies. So we want to prepare ourselves better for the next pandemic, and this means a twofold challenge. What about the healthcare system's ability to absorb and manage patients generated by the pandemic, for example, COVID-19 patients? Meanwhile, we want a healthcare system that can withstand that extra workload so they can continue to treat the other patients, patients with long-term diseases such as diabetes or heart failure. So, because when management of such illnesses is delayed, this means double jeopardy. This compounds the impact of those diseases. So we need a cross-cutting approach, and that is why we need a dovetailing of those three different intervention levels, local, regional, international, and that's what we need to cope with climate change and other challenges. We need proper access to medical countermeasures when the next pandemic hits. So we need local, national, regional, and international detection and surveillance systems. And that is what has guided the work carried out by France when it developed its own global medical and healthcare strategy for the 2023-2027 period. This was initiated in Lyon with the three former WHO directors. See, the dovetailing begins now. So, like I said, this initiative started in Lyon last month. And as I said, these three levels of intervention must dovetail with each other. And this has guided our priorities in terms of strategy. Let me give you a couple of examples. At a national level, one of the key challenges, and once again, it's a cross-cutting challenge, has to do with human resources. The lack of labor or the need for training, once again, is not a challenge that is specific to low-income countries. It's a matter for everyone.
Historiquement,
So yes, if we look at our history, in the past there may have been country-level HR resources, but now we need to take things up a notch in terms of training, in terms of recruitment. And that is why France supports the WHO Academy, which will begin work in October 2024 in Lyon, and which is intended to become an international reference center for training healthcare professionals. So, like I said, there's a dovetailing of national concerns for healthcare ministries, but also healthcare providers such as nurses and doctors. And like I said, the response, the intervention has to take place at different levels. So, still at a national level, what role do communities play? This is a key aspect. And we fully know, in the aftermath of the COVID pandemic, we know how important community involvement is. We need to be able to rely on communities. And like I said before, this is not specific to lowest income countries. Yes, in terms of global health, when you work together with other stakeholders, you always keep communities top of mind. But let me give you another example. In France, looking at the COVID-19 pandemic, if we look at the maps, when it comes to infection rates and patient management, the situation is very different, whether we're talking central Paris or disenfranchised suburbs. So in terms of prevention, you need to rely on communities. Otherwise, you miss the boat altogether in terms of prevention policies. So at a local level, national level, and also international level. So at a country level, one last example, and that's the perfect segue into the regional approach. We talked a little bit about surveillance and the need to share data and the One Health rationale, a cross-cutting approach between human health, environmental health, and animal health. Okay, that's what surveillance is all about. Of course, surveillance has to take place at a local level, national level, and of course, should also be done at a regional level. And we also had that discussion at the pandemic fund board level. That call for tender when it comes to surveillance, should we give a priority to national or international projects? Well, we need to do both. That's the only way to design a proper surveillance system. And then we need a regional approach as well. I talked about prevention and surveillance systems. We support regional initiatives such as the African CDC. There are CDCs everywhere, Centers for Disease Control, and that's absolutely key. So how do we ensure access to medical countermeasures? Same approach. We need a regional approach. We need a regional strategy when it comes to producing medical countermeasures. Not only is this interesting, it's absolutely key. And for that, we need regulatory bodies to get involved. So like I said, there's a dovetailing of these different intervention levels. I'm conscious of the time, so let me wrap up when it comes to the regional approach. Or rather, with regard to the international approach, what about standard setting? I know it's not really glamorous, but why is it important to have standard setting at the international level? What about a future global agreement on prevention, preparedness, and response to pandemics? It's important to ensure everyone's alignment on prevention strategies. How can we all work together and improve our preparedness in the face of future pandemics? At a regional level, but also at the international level, how do we make sure there's a proper coordinated international response? Resilience of healthcare systems also requires standard setting, and this means negotiations at the international level. Same thing when it comes to access to medical countermeasures. There are talks taking place at the international level. When it comes to ACTA, this emerged out of a French initiative in the midst of the COVID pandemic. Then what happened? It is our responsibility to lay the groundwork for the future, to prepare for next steps, think about strategy internationally to ensure fair access to medical countermeasures. Now, the issue of financing is absolutely key, and the Pandemic Fund is an excellent example of an international tool that brings together country-level players who sit on the board, and this facilitates local, national, regional, and international prevention efforts. So we've been talking about the need to strengthen healthcare systems, improve their resilience, and that's one of the key lessons we've learned from COVID. But we don't just mean fighting pandemics. We need to strengthen healthcare systems also to manage those patients who need it day to day. And that's what multilateral funds are doing, such as the World Fund. Last time in New York, about a year ago, the French president stated it very clearly. This is what France wants. 1/3 of the money is earmarked to this fund should be used at a local, national, regional, and international level. So, like I said, a 3-level intervention strategy. We need a global response to cope with future challenges while relying on what we've learned from the COVID pandemic. That is absolutely key. I'm not saying it's easy, but we have to do it. Thank you very much.
Thank you for bringing up that point about data, the data collaboration that went on that was created in a sense of urgency. This sense of the always-on agenda, how can we build going forward in a way that makes sense for emergencies, but perhaps also how can we take all the things that happened and were catalyzed during the COVID pandemic and make sure they're embedded in health systems. There's almost like a circular economy there to think about. Moving now to Dr. Rabalo, Magda. In a changing political landscape, how can we maintain focus on this agenda in order to build the kind of resilient healthcare systems we want to see, from detection, supply chain and R&D right to the delivery of medical countermeasures?
Thank you, Eloise, for that very easy question. Let me start by saying that it is really befitting that we are discussing this issue at the Paris Peace Forum, because and the theme for this year's forum is how do we reach consensus in a world of rivalry. And that question is critical and cuts across every sector of our lives, including health. The second point I wanted to make is to say, for us to continue keeping attention on this, we constantly need to remind everyone that we are talking about people. We are talking about saving lives. We are talking about keeping people healthy so that the economies can continue to grow and we can continue to generate the resources we need. People at the center of our thoughts and our endeavors. Number 3, and I think Priya mentioned that, is the continuous cycle of panic and neglect. I think this time we should resist panic and neglect. And we are well equipped to know that we can't allow neglect to install and continue going. I think it was a great success to be able to stage 3 high-level summits on health during the last General Assembly of the United Nations. That was, despite all that was ongoing, I think it was a moment to bring people together to say health remains important. We are going to COP28. For the first time, health is having a dedicated moment for us to think about the consequences of climate change or climate crisis, because the change is already there, on health, and then take action. We should use these opportunities as critical moments for not let go. We should really continue. We are the ones to be resilient first, so that the systems can be resilient. If we are not resilient, if tenacity is not there for us to stand up every single day, in every opportunity, in every room, to talk about how important health is for everything else to keep going, then we will giving up to neglect. Then let me now go into some more details, and some details about making systems resilient to shocks, but able to continue to provide the services that we need, needs important global things. One is effective global governance. No matter how strong a national government is, if at the global level we don't have governance systems that will enable and support the global laws and policies and instruments that bring nations together, we will fail. Another important element is the financial instruments that we need in order to generate the resources or distribute the resources needed in equitable manner, so that those who need it most get the most. And that calls for the solidarity that's failed us during COVID-19. And we really need to keep on talking about the need for equitable distribution of resources so that we can achieve greater goods for the benefit of the people. And then finally, I'm not pretending to be exhaustive, but among the global enablers that we need, I mentioned governance, I mentioned the financial instruments, and the third one is really the multilateralism, the forces of multilateralism that on the political agenda enables developed and developing countries together to move forward on agendas that are not necessarily converging, agendas where people have diverging interests. We are discussing, WHO is convening, Ambassador has been sitting on the pandemic accord conversations. It has been difficult, but we need to be tenacious. Equity, gender, and some issues around there need to go back to the pandemic accord. We need to make sure that what failed us during the COVID-19, equitable distribution of resources, never again would put the world in such a dramatic situation as we have seen during the COVID-19. Thank you.
Thank you, Magda. Really strong points. And I'm glad you brought up the pandemic accord. Perhaps the always-on agenda is a way to put to governments how important it is that they really step up at the pandemic accord process and take an interest in that really at the very highest political levels. I'd like to see if there's any questions from the audience, because we've all been to panels where there's not enough time for questions, and it would be great to have some questions from the floor. I'm just going to plant that seed. Does anybody have a question now for any of our panelists? If not, I have plenty more, but have a think. Yes, please, second row.
Thank you very much. My name is Laura Vai. I'm actually from the International Atomic Energy Agency. And the question is actually a little bit to all of the panelists, but in particular to the first two speakers. What do you see that is the role of science and technology? Because nuclear-related technology played a key role, actually, in the pandemic in terms of identification of the issue or the problem or the virus in this case, in the case of the COVID-19. But there is a lot that we are trying to do now in terms of networking and building on the capacity, so building the capacity of people in laboratories, not only in the global north, but especially in the global south, so that we can also work more and more with south-south mechanism. So is this component of the science also integrated in the policy that we are trying to bring forward? Thank you very much.
Thank you. Any other questions before I turn to the panel? Please, in the second to last row.
So thank you, Casimiro Vizzini from the One Sustainable Health for All Foundation. I'm happy that Madame l'Ambassador has mentioned the One Health approach, but I would like to ask to the others, how much important is this approach, and how are you thinking the role of changing mindset on this direction? Thank you.
Great. Any more questions? One more, then we'll turn back to the panel. Thank you.
Thank you. Is it okay if I speak in French? Oui. Yeah. Merci. So,
Christophe Garoun, I'm an epidemiologist, a doctor, and I'm in charge of, I was in charge of a cell before the crisis, and this was in Africa. So, now since that, I establish trials, programs, set up surveillance systems that set up surveillance, to provide a response to epidemics, because the situation has meant that the NGOs have received quite considerable funding after the pandemic, and this is something that we saw during the Ebola pandemic in Western Africa. And what I've seen, therefore, is that we're trying to strengthen a health system which has often been made fragile, and we're sort of plying in money and money into surveillance as well. But surveillance is just a small component of health. So it's an additional layer, if you will. It allows us to feed policy and provide a response to pandemics. So a very small part. And I'm going to talk about Djibouti and other parts of Western Africa. So we are providing a lot of financial means to this part that will also create human means for fragile systems. And this reminds me of the Vertigo programs, where we were just concentrating on tuberculosis, malaria and things. But from a strictly operational point of view, so these, maybe we're heading for failures. So in terms of our health systems. So it's just a comment, but there is a question as well. So is there a real solution to this issue? Thank you. Does anybody want to respond to that question, to that last question? Madam Ambassador? So I'd like to go back to the first question as well. So, in fact, your question in terms of surveillance and investment that we're making post-pandemic, is this just a reaction that is focused on what we've really experienced, or can we have a more global response to the matter? So I've been through the Ebola crisis myself, and also I helped to draft a response to COVID, but so I hoped I could stop there, but that's not the case. So we need to have a spontaneous, rapid response without providing a global response. So in terms of the COVID crisis, and this is different from the Ebola crisis, it's the global scale of a pandemic like COVID-19 that requires a global response. And you took the example of surveillance. When we talk about surveillance, so it's not the small part of surveillance that we're we should focus on. This allows us to predict things, of course, but this approach that you mentioned, if there are alerts and weak signs, this One Health approach, there is something which is emerging. But surveillance is about much more than that. When we talk about strengthening surveillance systems for pandemics, but also for the rest, and if we take the call for projects for the pandemic fund, so there are several aspects there. You've got surveillance, laboratories, and also human resources. It's not just one surveillance system for pandemics that will allow us to strengthen health systems. If we strengthen the laboratories' capacities as well, we'll be able to globally strengthen surveillance. And this is what we're trying to do as governments. We're representatives of governments, and in those bodies where we're present, and when we have to decide on a funding strategy and have to decide on priorities for that funding. So I'm not able to say, okay, we'll be able to do this and there won't be another pandemic. There will be others. However, the approach that we're trying to establish is this approach, a global approach, not just taking one single subject, but to look at health systems through surveillance, through human resources, through funding, through laboratories, and look at it in a global, holistic manner. That's what we're trying to do.
Merci beaucoup. Can I ask Ines and Priya to come in on perhaps on both the role of science and technology question, and if you have any remarks on the place of One Health, the second question we had. Ines?
Sure. I mean, I'll definitely take the science and technology because I think that's at the very heart of what we're trying to do. And so one thing I want to say is that the always-on approach doesn't cover all the aspects of the health system. So and we're definitely not saying that we're trying to do that. There's so much work. We want to prioritize it. It's basically, I think, a more pragmatic approach to try and encourage world leaders that you do need to invest and you have to take ownership here. And so the way we're trying to encourage that is in very specific parts of the health system, which will, like I said before, help your populations today, but then also help us be better prepared in the instance of a pandemic or another global health emergency. And so I said life science is at the very heart of what we're trying to do. Or science and technology, because one of our core use cases is, for example, trying to build clinical research capacity across Africa. And so we're trying to get funding, and we're working very closely with many trial sites across the region to boost and, like the ambassador mentioned, increase the quality of research that they're able to do, number one. And then the most important thing is create demand for the use of those centres. One of the big problems we have in Africa is people will come, CROs will come in, run trials, dismantle, and then leave, and then there's a big gap. And then the next time you need to run a trial, it's also very expensive. You have to build everything up from scratch. It's like a similar scenario to what we had in the pandemic. So the key thing is this always on, always in use. And so this demand thing, for me, is key. And that's why I think the idea is actually very clever, because if we are working closely with the private sector, then, for example, what we're trying to do is we're trying to encourage them to make use of these new sites that we help build up the quality of and the capacity of, to use and run regular trials in that part of the world. So that will be increasing demand. It's good for the private sector, and they're not top of my priority, but it's good for the private sector. It's good for the research sites because they're constantly in use. It's good for the health system because we'll be better prepared and it's more resilient, and it's good for the local population as well because we're using diverse patients, for example, and good for everybody, for global data, because we need more diverse patients. So there's many wins, and I think that's the clever thing. It's not going to solve all the problems, like you were mentioning, but I think it's a good pragmatic way of keeping things moving, and while it's the priority on the agenda. Priya.
No, thanks. So very briefly on the role of science and technology, agree with everything that's been said. We were in a panel this morning that was about the importance of collaboration between science and policy makers. I think what COVID-19 has shown us is that it's absolutely vital for for effective collaboration between science and policymakers and finding solutions in the wake of a crisis. But I think there's also a lot to be done in interpandemic years during so-called peacetime to make those investments in research and development and so on to ensure that the world is better prepared. So absolutely, the role of science and technology is vital. Technology, very important in terms of data sharing. So, we at the Pandemic Fund, for example, supporting many projects that will help grow that surveillance capacity. But once those investments are made in surveillance in labs and so on, then you also need to be able to share that data, across from subnational to national to regional to global level. In order to be able to effectively detect and contain future pandemics. So I could go on forever, but absolutely important science and technology. On One Health, as the ambassadors already mentioned, this is a very important principle of the Pandemic Fund, not least because we are supported by several governments, including the government of France, which place a strong emphasis on One Health. And this, 70% of emerging infectious outbreaks are zoonotic in origin. Every single pandemic in my living memory has, been of zoonotic origin. It's absolutely vital to be able to devise and implement approaches that recognize the interactions between animal health, human health, and the environment. We've heard about how climate change is exacerbating the risks of these kinds of diseases that originate in animals and can be transmitted and spilled over to human beings. So, in the face of all this evidence, a One Health approach is absolutely vital. And what is that? That is just having, approaches to surveillance, to detection, to diagnostics that build capacity to be able to look at both pathogens that emerge in animals and pathogens that emerge in humans, and particularly pathogens that have the risk of spillover from animals to humans. But it's also focusing, when we talk about workforce, it's not just doctors and nurses, it's veterinarians, it's building capacity of labs who can that can do the diagnosis of these animal-borne viruses and other pathogens. So really across the board, and 80% of the projects that the Pandemic Fund is supporting through its first call for proposals are focused on One Health at prevention level, One Health preparedness, and also building that capacity for response. And maybe one last point that I would have liked to make at the beginning that I didn't, and I think the ambassador made that point, but I just want to emphasize that again, which is that when we talk about preparing health systems for future pandemics, or we talk about building capacity to build resilience, I think one dimension of this is that surge capacity, which is so you need to build capacity during interpandemic years. That is kind of the basic levels of capacity, but you also need to prepare for surge in workforce, labs that can do scaled up testing, capacity to do scaled up surveillance. So it's this kind of surge dimension, which is also something that we are, through our projects, investing in during peacetime, so that then when the pandemic strikes, you're not caught up in a world where you may have the financing, but you don't actually have the workforce. You don't actually have those labs that can do rapid testing. So that's kind of one more point that I wanted to highlight. Thanks.
Thank you so much, Priya. Magda, you talked before about the importance of people at the heart of this. And I wonder, is the always on agenda, this idea of if we invest now, we're getting benefits now, is that going to appeal to people and populations and communities more? And if not, what do we need to do to keep people at the heart of this always on agenda?
I think we need to avoid the resist the temptation to have quick fixes. We want immediate solutions. We want to solve the problems tomorrow. Some of these problems are hard to solve. They will take time. We need to invest in research. And we need to facilitate exchanges from around the world. Only learning from each other, we can avoid some mistakes that are repeated, and we can also enrich the outcomes of what we do. It is so good that at the same time, Paris is also hosting the 11th Forum of the EDCTP. For those who don't know, EDCTP is a European and developing countries partnership for clinical research, which is a very strong partnership which has been going on for 20 years and is now starting its next cycle with $1.6 billion for research. So that's also another opportunity for us not to lose hope. So no quick fixes. We also need to resist this practice of working in silos. One Health is failing to become the glue that will help us work together, because environment, health, and animal health continue not to build the bridges that are required for us to maximize the impacts that we can have by implementing One Health. So, Eloise, there are no quick fixes. We need to work one day at a time with our eyes on the horizon. Look at the big picture and don't forget that we are doing this for people, be it for health, be it for food security, for being resilient to climate disasters. It is the people that we need to put at the center, and that cannot be different for whatever we are doing. Thank you.
Thank you so much, Magda. And I think you've ended us well on that note. This idea of an always-on agenda is really about building resilient health systems. Why do we want those? We want to save lives. We want people to have trust in their healthcare workers, because they're seeing healthcare workers all the time, not only when there's a scary pandemic on the horizon. So that's absolutely at the heart of all of this. Thank you so much to the Paris Peace Forum for putting this on the agenda, helping keeping these vital issues on the agenda. Can I ask you to give a warm round of applause for our excellent female panel? And wishing you all an excellent day. Thank you so much.